Can I come in?
Yes, ma'am.
Hi, Cedric. Nice to meet you. My name's Erica. I'm going to be the student midwife doing your assessment today.
Okay.
We're just going to do a quick assessment of your lungs and your heart. Just take a listen and make sure everything looks and sounds okay.
Yes, ma'am.
All right. Can you tell me your name and date of birth?
My name is Cedric, and my birthday is June 30th, 1993.
And what year is it right now?
2023.
And where are we at?
Doctor's office.
Okay. So my patient is alert and oriented. Affect is appropriate for the situation, and he appears to be well coordinated. For this assessment, I am going to have you take your shirt off, and I will have to just kind of touch your chest and your back a little bit, if that's okay.
Yes, ma'am.
Okay, you can take your shirt off.
Okay.
Thank you. So first, I'm going to inspect the chest, both the front and the back. It looks symmetrical. I don't see any chest wall deformities, no sunken chest or anything like that. I'm not noticing any increased work of breathing or obvious signs of respiratory distress. I'm going to look at the back as well. It looks symmetrical on the back and the front. So I'm going to have you take a big breath. I'm going to touch, okay?
Yes, ma'am.
Big breath. Good. Same for the back, okay?
Yes, ma'am.
Big breath. Good. So there's symmetrical movement anteriorly and posteriorly. I don't feel any crepitus. I don't hear any wheezing or adventitious breath sounds without the stethoscope. And it looks to be a regular rate and rhythm of inspiration and expiration. So next I'm going to palpate for tactile fremitus. This is going to just check kind of the vibrations throughout your lung fields, and it does involve touching the front and the back again, okay? So I'm going to touch right here, and I need you to just say 99.
99.
Good.
99. 99.
Good. And do me a favor, let's lean forward just a little bit. Okay, let's try that again.
99.
Good.
99. 99.
Okay. And same for the back, okay?
Yes, ma'am. 99. 99. 99.
Good. So the vibrations throughout both front and back feel the same bilaterally. There's no increase or decrease fremitus or vibrations in the lung fields. And if there was any increase or decrease vibrations, that could just be a sign of like fluid, pneumonia, air trapping diseases like emphysema or something like that. But I don't see any of those problems at the moment. Next, we're going to percuss, and we do that by placing our fingers down on the chest wall. We're going to keep our middle finger with a tight seal against the chest and raise up on the rest of the fingers and tap. And anytime that you're listening, percussing, or comparing anything in the lungs and the heart, you always want to go side to side to compare in that ladder pattern. And on this left side of the chest, it has a dollar sound from the heart. On this side, if we go too low, we could hear the dullness of the liver. And we're going to do the same on the back, okay? Do you want to turn? We can turn.
Figured.
Were you able to hear the difference over the heart?
Yes, ma'am.
Just a different pitch. Okay, and the percussion sounds the same on both sides. Next, we're going to listen to your lungs. I'm going to go over here. Okay. Turn this the right way. And we're going to start again in that left to right ladder pattern. We're going going to start at the apex of the lungs, which are above the clavicles. And when I place my stethoscope down, I just want you to take some nice breaths in and out through your mouth, but not like an exaggerated breath, okay? And I'm going to listen to the full inspiration and expiration on both sides at every point. And then I'm going to have you lift your arm up so I can listen laterally. Listening laterally is the best way to be able to hear the lower lobes of the lungs. And then on the right side, you also have that middle lobe. It's a little bit harder to hear anteriorly. So if we listen laterally, we can get a good sound of both the middle lobe on the right and both lower lobes. So just raise that arm up for me. Good, and I don't hear any fluid, any wheezes. Your lungs sound clear. Bilaterally, I'm going to have you turn your chair so that your back is facing the camera. That's good. And we're going to listen to 8 points on your back. And just to note, sometimes it's good to have your patients either give themselves a little hug or kind of pull their arms to the front of their chest, because we have the scapula in the back. And rest your arms. I don't know if you can see it in the video, but if you're trying to listen over this bone, you're not going to hear lung sounds. So go ahead and give yourself a little hug. Okay. And we're going to listen kind of in like a curve down and around that scapula on both sides. Okay, and the lungs also sound clear posteriorly, both the left and the right lungs. I don't hear any adventitious breath sounds or see or feel anything of concern there. So then we're going to move along and turn back towards the video, please. Have you sit forward just a little bit. Thank you. And we're going to check for egophony as well as whispered pectoriloquy. So to check for egophony, I need you to say the letter E when I move my stethoscope each time, okay?
E, 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 E.
Good.
E, 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 E.
And if there was any areas of consolidation or anything of concern like that, then the E would sound like an A. And these vocalizations are more prominently heard in the areas of like the upper airway, and they kind of decrease in sound as we work our way down. Can you sit forward for me? And we're gonna do the whispered pectoriloquy. And this is where I just need you to whisper the 99, okay? 99. Okay, and I don't hear any changes in the 99 either. It's very faint and almost not able to be heard. The next thing we're gonna do is listen to your heart, okay? So I would have my patient lay down, that he's sitting in a chair. So I would have him lay down, raise his head with like a pillow to a 30-degree angle, and tip your chin that way. And I'm looking for any like jugular vein distension or pulsations in the carotid artery. Back to respirations, this would be a good time to see any like retractions. I'm gonna look at this side as well. And I don't see any jugular vein distension or pulsations in this side either. Do me a favor and just turn towards me. Okay. And then I'm gonna palpate first. So I'm feeling for any heaves or thrills. This is like a vibration feeling from the heart contraction or like a palpable pulsation. I'm just gonna place my hand on your chest here. Sternocleidomastoid, the base of the heart, and the apex. Also, the apex apical heart landmark is the midclavicular line, 5th intercostal space. This is where we can find the PMI, or the point of maximum impulse. Also, to be able to find your intercostal spaces, you can just do this walk down method and kind of walk down with your fingers. We have our 5th intercostal space. And the PMI is tapping 1 centimeter. That's good. So there's no heaves, thrills, no obvious pulsations or like bounding pulses. So I'm gonna listen. There's 5 cardiac landmarks that we're gonna listen to. That is the aortic, pulmonic, Erb's point, tricuspid, and the apex or apical pulse. Okay? And to do this, we're gonna listen with the diaphragm and the bell of my stethoscope. To find the aortic, it's on the right 2nd intercostal space. And we want to listen for a full cardiac cycle. That's the lub-dub, contraction and relaxation of the heart. And S2 is the closing of the semilunar valves, and this is best heard at the aortic and the pulmonic. Good. Erb's point is at the 3rd intercostal space, midclavicular line. And this is the halfway point of the heart between the base and the apex. Tricuspid is at about the 4th intercostal space. And then the apical pulse we can find at the 5th intercostal space, midclavicular line. And this is where we can hear the S1 closing of the AV valves. Good. I'm going to listen for any murmurs or anything like that with the bell of my stethoscope. course, when I touch my patient, I would make sure that my hands are washed and that I'm touching them with gloves. I don't hear any abnormal heartbeats, no S3 or S4 noted. He has a regular rate, regular rhythm. And I think everything sounds pretty well for him. Do you have any questions, comments, concerns?
No, ma'am.
All right. Thank you very much.
Yes, ma'am.